Last speaker today is Betty Kitchener. Betty is from Flemington, Kensington Rotary Club. Her husband's with Rotary Club of Carlton, that's Tony Jorm. And they've got a hard luck lockdown story at the moment. They're actually in northern New South Wales. They're up near Byron Bay. They went up there for a holiday quite a while ago, and they got stuck. So they're suffering there with their morning walks along the beach and their glass of wine at night. And somehow I've done a deal up there. Betty was saying they get very cheap rent at a lovely place overlooking the water. So we've all got our COVID stories, but Betty's got a really good one. So look, today we want to talk about the mental health first aid kit, and Warwick Cavill from Central Melbourne flagged this as a really good project idea. And look, a lot of the Rotary clubs at the moment are frustrated that they can do clubs, but they can't do things. And so this was a program where we might get the skills to be able to talk to people in the community that are actually struggling and to be able to do something about it, rather than just dismiss them, to actually have a proper process of actually engaging with them and then referring them. And so Betty's the author with her husband, this fantastic initiative. So over to you, Betty. Love to hear a little bit about it, and then we'll talk about calls to action within our district.
Thank you so much. I've got a PowerPoint to show, and there's so much to tell you about this program, but I'll just focus on how can it be used for us Rotarians, and what can we do with it. And I'm really thrilled that Warwick has thought about this, and also Suresh Makadan, who's the director of the District 9800 ARH, Australian Rotary Health Committee, has also approached Tony and I to see if we could do something with the Mental Health First Aid program. So let me just quickly go through a review of it. Yes, it is something Tony and I began on a dog walk before the turn of the century. We came up with this idea. I've been a registered nurse. I've done a number of things. I've been a school teacher, and I was also in my part-time teaching first aid for Red Cross. This is when we lived in Canberra, and Tony's had been at a research meeting. He's a mental health researcher at the University of Melbourne now, and he said, "Oh, what do you reckon about mental health first aid?" And I thought, wow, yeah, that sounds wonderful. And that's where it all began. So this is the definition we came up with: mental health first aid, that it's the help provided mental health first aid is the help provided to a person developing a mental health problem, or experiencing or worsening of an existing problem, or in a mental health crisis. And the first aid is given until appropriate professional treatment is received, or until the crisis resolves. So it certainly isn't teaching you to be a therapist or a counsellor or anything at all. It's a 12-hour course, and it certainly trains members of the public to help your neighbours, your family members, your work colleagues, etc. Oops, I'm having trouble moving on. What's happened? Oh, there we go. So why do we need mental health first aid? You've probably all heard in the media, etc. Mental health problems are really common. It's interesting, so many of us have probably done a regular first aid course, but mental health problems are more common than things like a lot of the health conditions that we learn about in first aid courses. And many people aren't as well informed about mental health problems. A lot of us know about heart disease and cancer, but for numerous reasons, we don't know so much about mental health problems. And many people don't seek help, and this could be because there's a high level of stigma and discrimination. That certainly has improved over the years, but it still is there. And some people don't realise they need help. That's the nature of some mental health problems. They become a bit deluded and don't realise that they're in need of help. And sometimes they don't know where to go to get effective help. And often professional help is not always available. You may have seen in the ABC News just today saying what a long waiting list there is for people to be able to get to see a clinical psychologist or a psychiatrist, unfortunately. And Tony, being an academic, has ensured that we have had this course really well evaluated. Many other people have evaluated it now. And it certainly has shown that if you do a mental health first aid course and you offer mental health first aid, that it really can help the person that you're with. And I won't go into all the research we've done, but it certainly improves better knowledge, better attitudes, and certainly the help that you offer as a first aider is so much better. I do seem to be having problems here. Okay, so I said I wouldn't go into evaluation. So for those who are quick readers, there are lots of different things that we found in different randomised controlled trials, etc., that we have done. So mental health first aid, as I said, is not treatment. It's not replacing any mental health clinician. It's actually drumming up business for them. And it's really what I like to call the early intervention. It's what we as members of the public can do to help somebody. And we've come up with an action plan, just as you have DRABC in physical first aid. We have ALGEE, approach the person, assess and assist with any crises, listen and communicate non-judgmentally, give support and information, encourage a person to get appropriate professional help and encourage other supports. And we have got a mascot, Algie the koala, to help remember this acronym. Now, when you give support and information, this is at a first aid level. When you listen and communicate judgmentally, you don't just say, all right, I've done that, now listen to me. These are not steps, these are actions. So you do these in different order, you do some of them all of the time. So the mental health first aid course, we never envisaged this at all when we were on our dog walk before the turn of the century, that this would go so far internationally. But over 4 million people now have trained in this, and the organisation we set up, Mental Health First Aid International, trading as Mental Health First Aid Australia, licenses suitable organisations overseas to run this course. And how did we know what to put in this course? There's certainly clinical practice guidelines so that mental health clinicians know how to offer help, but there was nothing out there really to say, well, this is what members of the public should do. So again, a lot of research to develop lots of individual guidelines, and all of these are available on the website, which you can see there at the bottom of the screen. There's many more than this. We've done ones also to different things to consider when providing mental health first aid to different people, etc. And with all that knowledge, we've developed mental health first aid courses. Now, the one that I think is probably most helpful for Rotarians is what we call our standard course, and that's adults helping adults. The youth is adults helping teenagers, so that's very suitable for teachers, youth workers, sports coaches, etc. Teen is teenagers helping teenagers, and that runs in schools. Older person, and that's quite suitable for us too. It's offering help to someone who's age 65 and over. Certainly depression, anxiety are big there, and also we touch on dementia there. And we have specialised courses for Aboriginal and Torres Strait Islander. And then we have these specialised courses which go for about 4 or 5 hours, looking at some particular things. So our courses now, because of COVID, we used to deliver them face-to-face. The standard course, Adults Helping Adults, is a 12-hour course, 4 sessions of 3 hours each. But Mental Health First Aid Australia has now done it. You can do blended courses. There's an online section that you work through at your own pace. You can come back to however you like. You have to pay $88 to Mental Health First Aid Australia. I can't get that for free for you, unfortunately. And then you can either have a face-to-face 4-hour course, or you have 2 Zoom meetings. Now, I'm really happy to provide that for free. That's where the instructor comes in, and instructors will charge a fee. I can deliver that free. If we're able to do face-to-face 12-hour courses, then I can deliver that free, and all people would need to pay is $16 for the manual. There's some of the booklets that come from the specialised courses. So in the standard course that I think would be best for us Rotarians to do, we look at these mental health problems here. What do we mean by depressive disorders, anxiety disorders, psychosis, substance use disorders, eating disorders and gambling problems? In the course, we don't have time to address those unless we want to make the course longer, but it certainly is in the manual that you get. And then we learn all the skills of how to recognise and help with these crisis situations that are listed here. And at the end, you get a certificate. Now, if you just do the e-learning course, you get a certificate of completion, but if you then go on and have the face-to-face section with the instructor, either face-to-face or online, you then can do an exam, an open book exam, and you become accredited, just like with a regular first aid course that goes for 3 years. Thank you.
Thank you so much, Betty. That was fantastic. I think from a district point of view, our next steps are that we're intending to promote with clubs, whether they might want to get involved, even a community service chair from each club, or someone that's passionate about this mental health first aid kit, and to run a pilot program, and to do that sort of sooner rather than later. And then once we've done that, to maybe then look to roll it out, because I think it's a really tangible way that Rotary clubs can actually do things in a COVID environment. You know, we're frustrated with some of the service work we can't do at the moment, but one thing we can do is talk to our neighbours, talk to our community, and be able to ask the right questions when you're coming across people that are suffering mentally for all sorts of different reasons. So thank you so much. Again, we'll follow that up in the email from today, next week, with just the next steps for clubs and or individuals to get involved. So thank you.
I just see there's some questions in the chat, and a lot of
Okay.
people saying they've done the course and how wonderful it is.
Okay, do you want to talk to that, Betty, or not?
Well, that's great. You can all read the chats and see that people are saying it's a great course. And yes, we've certainly done it in Ripen. We've run it. Someone is saying, who is liable if a patient misunderstands the intent of the mental health practitioner, resulting in damages? Well, we're very strict on how we train the instructors to say, look, you are offering help. You're not there as a practitioner. So there's been no legal cases at all, and it's not getting people. It's not, you don't actually tell people you must do this. You actually assist them to go online or to get professional help.
I mean, I did a little summary here. I was saying, so the basic structure is you're recognising the signs of mental health problems with an individual, and you also reach out to the person and really refer them. And so you actually you de-escalate with the person and you refer them to the experts. So you're not actually providing advice. You're actually just identifying the issue. Yeah.
The idea is that you get the communication skills so the person is able to talk to you, because the stigma around it. And then often they'll say, well, what do you think I should do? So then you can then go on to the action that says how you offer support and information. It's really easier for us here because we do have pathways to care. We're now being asked to deliver this course or write programs for this course in developing countries, in middle income countries, and they don't have the pathways to care. So it's actually, you'd have to have more skills as the first aider.
Thank you, Betty.